Hi, everyone. I'm Holly Cohen with Preferred Medicare, your licensed independent broker. And I've got some really big information for you today. We are a family-owned agency helping Medicare beneficiaries in 50 states. And when you give us a call, you're either going to speak with me, my husband, Steve, also a licensed agent, or one of our trusted agents on our team. And sometimes that's one of my adult children that you might be speaking with. So today I'm here to break down the urgent changes for Medicare 2025 annual enrollment period. I'm going to explain the new rules and how they will impact your prescription costs and how you can add your medications on Medicare.gov to compare plans for Part D. I'm going to show you a quick tutorial towards the end, so let's jump in. So there are massive Medicare changes coming in 2025, and here's what you need to know. Number one, prescription drug costs will be capped at $2,000. Starting in 2025, Medicare is capping out-of-pocket drug costs at $2,000 per year. That's right. Once you hit $2,000 in prescription costs, your copays, that means you're not paying for anything after that. So it does help people who are on prescription name brand medications that can exceed the $2,000 mark. And this makes the annual enrollment period that runs from October 15th through December 7th more important than ever. It is the time coming up very soon to review your plan and your medications, especially if you have original Medicare with a Medicare supplement and a standalone Part D. You want to make sure that you are reviewing that, especially for 2025. A lot of people will go year after year on a Plan G or a Plan F or a Plan N, and they have a standalone Part D drug plan, and they don't review it. And then they realize that lots has changed. So this year, more than ever, coming up this annual enrollment period, please be sure to review what you have for your Part D. And also, of course, if you're on Medicare Advantage, make sure you review that because those will be changing as well. So Medicare is also introducing a prescription payment plan in 2025 that lets you spread out your drug costs over the entire year. So instead of paying a large sum, a large deductible upfront at the pharmacy, you will get monthly bills. If you have high drug costs, a name brand prescription early in the year, this prescription payment plan will help you spread out the costs throughout the year, even if it's below the $2,000 cap for the year. So with this new prescription cap of $2,000, it also means that premiums for standalone Part D plans may increase for 2025. So please make sure that you go on to Medicare.gov. You can do that now and set up your own account. I will do that with you in just a moment. Okay, so here we are over on the Medicare.gov website. Make sure you are on the official website of the United States government, Medicare.gov, before you get started. You want to go over to this upper right, make sure this nice lady is here on the cover. Go up to the upper right, I'm going to click on Login, and that will take you to this screen that says Create an Account. So then you're going to go down to Create an Account, then have your Medicare information ready, enter your Medicare number and your coverage start date here on the official Medicare.gov website. Put your Part A coverage start date, and then you click Next. And I didn't fill it in, obviously, so it's not it's staying all red. But then it's going to take you, once you're inside your account, you are going to see this screen that I'm going to show you. So this gentleman will come up, this guy, and you're going to put in a zip code. So I've selected a zip code, just type in your zip code and click Continue. And then we're looking at drug plans for 2025. So you're going to click on Medicare Drug Plan Part D, Find Plans, and then do you get help with your Medicare health or drug costs? You want to answer that the way you know how, or if you don't get any help, you say, I don't get any help. And so we click that, Continue. Then you will be here where it says confirm your drug list, add a drug. Make sure when you're putting these medications in that you are spelling everything correctly. It will pop in if you just put the first 4 letters. That's a very common one, atorvastatin. Make sure you have the correct dosages, correct quantities per month. Add to drug list. If you have another drug, go ahead and add that one. There's that common blood pressure medication, 10 milligrams, let's say, once per day. So that's 30 every month. Add to drug list. Now, once you're complete with adding your prescriptions, you are going to then decide what pharmacy you like to go to and shop at. So you can go here and click on the distance. It will take you as far out as you want to go. Say you don't want to drive more than 10 miles. You can either put in your pharmacy name or you can look for it down here. So you can click and unclick these boxes for your pharmacies. Down here it will actually give you, once you've clicked, I've already clicked mine, once you've selected, you can select 1, you can select 2, you can select 5. So that's up to you, but it does go max 5. And then click done. And then it's going to show you, and this is a 2024 plan because they have not yet released the 2025. So it will now show you the lowest cost drug plan in your zip code based on your prescriptions. And then you can even click here and see how much you will be paying at each pharmacy per medication for the year. So, this is the end of the year. So this medication is $0 at these pharmacies. And then you can even open up each pharmacy and see exactly what it would cost at each pharmacy for the medications. So if you have any questions at all, feel free to give us a call. Either me, Holly, or Steve, my husband, also a great agent at helping people with their prescription plans. We're always here to help you every year. Please make sure to put in your medications correctly, as this can change your costs. That's why this year more than ever, it's crucial to review your Medicare Part D. And please remember, when you call our office, we'll help you do that. At Preferred Medicare, you always get personalized advice from someone you trust, whether it's me, Steve, or an agent from our team.